We come to the last presentation of the day of this scientific session. Mr. Dilbar Iqbal, he is the principal scientist at PSNM, and his topic is medical physicists' role in QA and QC nuclear medicine, focusing on theranostics. And unfortunately, you will have to be to face this comment that you have to wrap it up in time, because after that we have to proceed for our final function of the day. Dr. Dilbar Iqbal.
Thank you. I will try. Bismillahirrahmanirrahim. Assalamu alaikum. I am Mr. Dilbar Iqbal as a medical physicist in PSNM Cancer Hospital, and my topic is medical physicist role in quality assurance and quality control in nuclear medicine, focusing on theranostic. Quality assurance is a component of quality management focused on the providing confidence that quality requirements will be fulfilled. Quality assurance includes all activities that demonstrate that level of quality achieved by the output of a process. Quality control is a component of quality management focused on the fulfillment of quality requirements. It includes activities that impose specific quality on process. Quality control involves the evaluation of actual operating performance characteristic of the device or system. Quality control works on the input to a process. Let's try to understand this concept with the help of this example. Let's suppose the quality policy of a nuclear medicine center is based on the quality objectives. There is a quality assurance nuclear medicine scan is the quality objective of a nuclear medicine center. And under this quality objective, there are few processes. One of those processes is acquisition of a nuclear medicine scan. And to get a higher quality assured scan, we have to confirm that our gamma camera or PET CT or anything is capable of producing the well quality image. And this is done by performing some quality control tests such as energy resolution, spatial resolution, volume sensitivity, and other necessary corrections. The quality controls act as input to a process, while the output of the process nuclear medicine scan is the output of this process, and acquisition of nuclear medicine scan is the process. The quality control will ensure the quality of the nuclear medicine scan, and quality assurance basically is the confidence level. And quality controls increase the confidence level of a quality of a nuclear medicine scan. Nuclear medicine scan may be qualitative and quantitative. There are two types of nuclear medicine imaging. One is qualitative and the other is quantitative. For qualitative image analysis, as in diagnostic nuclear medicine, radioactivity is not so high to cause deterministic effect. That time losses are not so important, while in quantitative nuclear medicine imaging, high accuracy of radionuclide distribution is required, is used for quantitative image analysis, as in the therapeutic nuclear medicine, such as measurement of SUV, standardized uptake value. High radioactivities are involved and dead time losses becomes significant. SUV is the ratio of radiotracer concentration in tissue megabecquerel per ml divided by injected dose divided by patient weight in the grams. Quality control tests are required to get the confidence to get nuclear medicine imaging measurement with reasonable accuracy and precision, especially required in theranostic applications. Certain quality control tests need to be performed to evaluate the performance of imaging equipment. QC test may be divided into planar image for tomographic image and for whole body, and for image registration as well. First of all, what is energy resolution? It is the ability of a gamma camera to differentiate between the photons with different energies. Point source is placed at a distance of greater than 5 UFOV for intrinsic energy resolution from the camera head, and data is acquired. From this data, the graph between energy channel and count density in the channel is plotted. On the x-axis in this graph, there is a number of pixels, number of energy channels, And energy per channel calibration factor, where two different sources needs to be calculated before performing this test. KV per channel is basically the difference of energy between the two sources divided by the number of channels, energy channels for those energies. From graph, full width at half maximum is measured and is expressed in percentage. Similarly, extrinsic energy resolution is also performed, but with the help of flood source. And next test is quality control test is spatial resolution. It is the ability of a gamma camera or PET camera to take the image of two separated point sources as a separate. The point sources is placed at greater than 5 UFOV for intrinsic spatial resolution, maximum count rate 20,000 counts per second. Count rate should be less than this one. Test equipment lead mask with white parallel slits, and the source, this phantom is basically, this is the phantom used for this study. These are the slits from which the energy will be coming from the source to the detector head. Thickness of lead thickness for technician especially is 3 mm. If other radionuclide is used, the thickness of this lead mask will be different. From this graph, basically graph between pixel location and count density in pixel is analyzed. Per pixel calibration factor needs to be calculated. Full width at half maximum of the plotted data will give the spatial resolution in millimeter. For extrinsic spatial resolution, lead mask is placed between camera head and flood source, and same data is required and analyzed. The lower the value of the full width at half maximum, it means the camera has more capable to resolving the energy of different photons. Lower value of full width at half maximum is better. Next test is flood field uniformity to check the response of imaging system to uniform flux of radiation on the surface of camera head. Same setup as with energy resolution will be measured for UFOV and CFOV. UFOV and CFOV is basically 75% of the useful field of view, which is the whole size of the crystal. For intrinsic and extrinsic, these tests are measured separately. Differential and integral uniformity will be measured. Integral uniformity is basically the ratio between the maximum and minimum counts in a pixel divided by maximum plus minimum counts in a whole image. While in differential uniformity, the difference between maximum and minimum is from 5 consecutive pixels in a row and column. Next is intrinsic count rate performance. This is a very important test when we perform the Theranostic as a quantitative nuclear medicine imaging. It observes the count rate versus input count rate. Distance from source to detector surface may be less than 5 UFOV. Source intensity initial input count rate should be high enough to cause fold over in observed count rate. Initially, the count rate, input count rate should be in this region, because if it is not in this region, then we cannot determine the maximum count rate, observed count rate that the imaging system can measure. And two methods are used to vary the input count rate. One is decaying source method, and the second one is copper plate method. From this data, this graph is required, and some values such as maximum count rate and the count losses at 80% count loss are measured from this graph. This graph is used for dead time losses correction in the image of the patient. Aspect reconstructed spatial resolution without scatter. Whenever we will talk about the tomography mode, we will talk about reconstructed, because all the data will first be reconstructed and then the measurements will be performed. Reconstructed spatial full width at half maximum resolution values in the X, Y, and Z direction will be measured from constructed volume. X, Y, and Z are basically the patient coordinate system. 3 point sources in the tips of separate capillary tubes placed 75 millimeter apart in the XZ plane, transverse plane, shall be used. Data will be acquired with counts in each projection should be greater than 20,000. Angular increment for each projection should be less than 3 degree. The count rate should be less than 20,000 counts per second. This is the points, 3 point sources at the tip of each capillary tube, and this is the x-axis means the patient in X right to left, and Y is the anterior to posterior, and Z is the along the length of the patient. The image of these 3 point sources will be acquired here, and from the reconstructed data, the resolution in all the planes, transverse slice, sagittal slice, and coronal slice will be measured, and in each plane, two directions, the full width of maximum of the point source will be measured, and then the average full width of maximum will be measured for volume. SPECT reconstructed spatial resolution with scatter. The last test was without scatter, but this test is with scatter. It means the radioactive source is inside a material causing a scattering. Reconstructed transaxial spatial resolution shall be measured using 3 line sources, 1 mm diameter in a water-filled acrylic cylinder of 200 mm length and 200 mm of diameter, aligned with the axis of rotation and centered in FOV. The central source, this one, should be aligned with the axis of rotation. Counts in each projection should be greater than 10,000. Angular increment for each projection should be less than 3 degree. The count rate should also be less than 20,000 CPS to avoid the dead time losses. This is the result of this test. The resolution in the central, in the tangential and radial field for all 3 sources is measured, and then the average resolution of in both planes is measured from this data. Next is system volume sensitivity. System volume sensitivity and the average volume sensitivity per axial centimeter will be calculated from this test. Accurately determine the activity concentration in kilobecquerel or millicurie per cubic. And the next is SPECT-CT co-registration accuracy. The purpose of this test, these are the 3. These are the 6 point sources, 1, 2, 3, and 3 in this plane, arranged in this fashion. The purpose of this test is to get the difference between the centroid in a SPECT image and in a CT image. For accurate distinction, this test is must. These are the centroid in the both imaging modalities, and the co-registration error is measured from this formula. Correction in quantitative nuclear medicine imaging. Some corrections are required to be performed in quantitative nuclear medicine imaging procedures used in theranostic, especially photon attenuation and attenuation correction, scatter and scatter correction, and the partial volume effect and partial volume correction. This is the photon attenuation correction. You can see the image here. This is the image of a phantom, and there is a disk of radioactive sources of equal activity. But when we take image, in this image, we can see that the activity in the center is less as compared to the activity in the peripheral area. This is due to the attenuation caused by the material. Attenuation correction is generated with the radionuclide source registration CT image, and the attenuation correction map is acquired and then implemented during the reconstruction process. And this is the scatter and scatter correction. There's the first is the image of is the distribution of activity in the phantom. In the black holes, circles basically cold areas, and this is the activity. This is the unscattered image, and this is the scattered plus unscattered. You can see that in the center area, this is the primary only, red one, and the blue dotted line is scattered plus primary. And we can see that in the center, the radioactivity is higher as compared to the actual contribution because this is because of scatter. This is partial volume effect. This is due to the spatial resolution, limited spatial resolution, and this can be achieved by, this correction can be achieved by the recovery coefficient method. And this is the recovery coefficient method calculation, then implemented, measured of the dose absorbed by the different organs in nuclear medicine. When we talk about theranostic, when we apply, we administrate the radioactivity in the patient, the different organs absorb the dose. Sometimes these doses may be greater than the limit or the threshold value for deterministic effect. And this is the method for measurement of internal radiation dose, and this is the output screen. This is the output screen which displays the dose received by every organ, different organs during a nuclear medicine procedure. This will indicate the level for threshold level for deterministic effect to be avoided. Thank you very much.